Welcome to the bite-sized winter preparedness session, which is all about sharing public health prevention messages to keep people well and warm at home over winter. I will be talking through the services available that can help support vulnerable people. Links to further information will be shared on the slides for you to access after this session. Also, feel free to contact me on this email address if you have any further questions. The aims of today's session are to increase your awareness of the risks for vulnerable groups during winter, to increase your understanding of services and support available for those most at risk, and also to be able to signpost key resources and guidance to further share winter prevention messages. This image from the UK Health Security Agency explains how cold weather can directly and indirectly affect health, even at temperatures as mild as 4 to 8 degrees Celsius. It highlights direct effects such as heart attacks, strokes, respiratory illnesses, influenza, hypothermia, and injuries from falls. It also shows indirect effects, including disruption to healthcare services due to snow and ice, and poorer mental health linked to cold homes and fuel poverty. Excess winter deaths are the observed total number of deaths in winter from December to March compared to the average of the number of deaths over the rest of the year. Excess winter deaths aren't just caused by extreme cold or hypothermia, but often happen during normal winter temperatures. When the average temperature drops below 5 to 8 degrees centigrade, it can make heart and lung conditions worse. The majority of these are preventable deaths. Every 1 degrees drop in average winter temperature is linked to around 8,000 extra winter deaths. The optimal indoor temperature is 18 degrees or above, which help prevent health risks. Below 16 degrees, resistance to lung infections decreases and blood pressure and heart disease risk rise. Public Health and Winter Priorities 2025-26. They are to reduce winter mortality and morbidity by implementing evidence-based interventions, and these are taken from the UK Health Security Agency Adverse Weather Plan, which is linked on this slide. The aim is to prevent the increase in years of life lost due to adverse weather events, prevent mortality and morbidity due to adverse weather events, reduce the use of healthcare services, and mitigate the health impacts of cold and cost of living. Key public health winter messages. There are 9 key public health messages that we would like to show you today in this training. Number 1 is to ensure you have your winter vaccines if you are eligible. I'll talk through winter vaccines shortly, their importance and where to access them. Number 2, check your medicines to make sure you don't run out during bad weather. Encourage people to speak to their pharmacy if they are unsure about their medication or need to reorder more to prepare for any cold snaps. Number 3, how to keep your house warm. Number 4, and where to go for help if you're struggling with paying bills or energy efficiency tips. Number 5, keep active and seek support if worried about a fall. There's a lot of support about keeping moving and falls prevention advice, which I will share shortly. Number 6, warm foods and drinks help us stay well over winter. To prepare for the winter, good practice is to store staple items like tins of soup, tea, coffee, beans, in case people are unable to get out to the shops. Number 7, encourage people to ask for help if they need it. There are a number of places to get support. Number 8, staying connected over the winter months can make a massive difference to how people are feeling and their overall well-being. And finally, number 9, be winter prepared. Being prepared for cold spells can make a big difference. So firstly, I'd like to talk through the adult vaccinations, the winter vaccination programme. Vaccines are one of the most effective tools we have to prevent serious illness. As we age, our immune systems change and we become more vulnerable to infections like flu, shingles and pneumonia. Vaccination helps reduce hospital admissions, protect vulnerable groups, and ease pressure on the NHS, especially during the winter months. Vaccine uptake in general is quite good, but varies significantly within communities and by levels of deprivation. Poor outcomes from infectious diseases are unevenly distributed across ethnic groups, with some ethnic minority groups experiencing the highest emergency hospital admissions. If someone is eligible for more than one vaccine, they can get them co-administered all together. This saves time as can access all in one visit. Further information about vaccines is linked on the slide. Flu and COVID-19 vaccines are offered to people most at risk of getting seriously ill from these infections, or who are most likely to pass these on to other people at risk, such as the elderly or children. The eligibility criteria usually changes each year in line with the Joint Committee Vaccination Immunisations (JCVI) recommendations. This year's campaign started in September 2025. Flu and COVID-19 vaccinations are delivered predominantly during the autumn-winter months through general practice and community pharmacies. It is important that those eligible get vaccinated as soon as possible to give themselves the best possible protection ahead of winter. Flu and COVID-19 spread more easily in winter as we spend more time indoors. Catching both viruses over winter increases the risk of serious illness even further. COVID-19 spring booster vaccinations are also available to certain cohorts of people in spring to provide extra protection. The eligibility criteria is shared nearer the time of the spring campaign. The flu vaccination programme, Winter 25-26. Based on the evidence that flu vaccine's effectiveness can wane over time in adults, the JCVI have advised moving the start of the programme for most of adults to the beginning of October. The eligibility for the flu vaccine from the 1st of October 2025, those aged 65 years and over, those aged 18 years to under 65 years in clinical risk groups, as defined by the Green Book, those in long-stay residential care homes, carers in receipt of carers allowance, or those who are the main carer of an elderly or disabled person, close contacts of immunocompromised individuals, and frontline workers in a social care setting without an employer-led occupational health scheme. COVID-19 vaccine eligibility criteria 2025-26. This is as this programme enters its fifth autumn season. The advice for this autumn is to offer the vaccine to those at high risk of serious disease and who are therefore most likely to benefit from the vaccination. Eligibility for the COVID-19 programme from the 1st of October 2025 is adults aged 75 years and over, residents in care homes for older adults, and individuals who are immunosuppressed aged 6 months and over. There are links shared here on how to book and access COVID and flu vaccinations. These are images of the current winter vaccination campaign, which hopefully you will recognise from TV or online. And you can access these winter vaccine resources from the campaign's resource centre or the Google Drive linked on the slide. Now I'm going to talk about the services that are available to support our vulnerable service users this winter. Home Plus Leeds support older people and those with disabilities to stay safe, warm and well, reducing falls and cold-related risks and live independently at home. They provide minor repairs, home adaptations, heating and energy advice, and help with benefits and signposting to other services. Active Leeds offers a range of activities to support people to self-manage their health conditions and build fitness, strength and balance. There is a link on the slide for further information. The Together Leeds website, linked on this slide, provides information and support to help residents with the cost of living, including money advice, housing help, food support and community services. Mindwell is the mental health website for adults and provides information about support and services available in Leeds, such as mental health services directory and self-help information. Find out more information on their website www.mindwell-leeds.org.uk. So what can we do now to support our service users this winter? Well, it is important to sign up to the Heat Health Alert system if you haven't already done so, and the link is again on this slide. This service sends out alerts to warn of periods of low temperatures which may affect the health of the public. They are aimed at health and social care professionals to support them and manage through periods of extreme temperatures. The Cold Weather Health Alert system is run between November and March. It will provide users with information on the impacts likely to be observed as a result of the temperatures. There are different levels of alert. As you can see, for example, a yellow alert will be issued during periods of hot cold, which are likely to affect vulnerable groups. The cold weather action cards are part of the UK Health Security Agency's Cold Weather Plan for England. They outline the key actions and responsibilities for different organisations and sectors before and during periods of cold weather alerts. The cards are designed to help organisations prepare for, respond to and recover from periods of severe cold. We have linked the Winter Friends animation, which is to share the short video with your colleagues to disseminate the key winter messages, and it helps to familiarise with the 9 evidence-based high-impact interventions we have previously talked about, including information on keeping homes warm, physical activity, hot food and drink, and social connectedness. Also, look out for the Winter Preparedness Bulletin, which has links to resources and key messages to support vulnerable people in the winter months. There are examples of keeping well and warm campaigns, and they are in a range of accessible formats. And these provide key messages to stay safe and well in the winter by planning ahead, keeping yourself warm and preparing your home. If you would like to receive this bulletin, please do email me and we will send this out to you. We have also developed a range of resources using the UKHSA guidance to help people stay safe and well in the winter. These resources are available from the Public Health Resource Centre and include a thermometer, which can be used all year round with tips to stay well in summer and winter, a Stay Well in Cold Weather poster available in A4 and A3, and a services poster. We also have resource bags available to support vulnerable people. If you would like any of these resource bags, please contact Anisa Anwar on the email address for further information. Thank you for listening. I hope you found this session useful. Please get in touch with me if you have any further questions or you would like any more information. Thank you.